Gout comes from the word gatta or drops of poison. It was initially thought that the royal family people who did lot of problems or lot of financial problems to the other parts of the society members got these drops of poison. But when we look back at history, we realize that only the rich people could afford a very high rich diet in purines, or maybe were obese even in that time. Why are we seeing lot of hyperuricemia patients in these generations? That is because of the metabolic syndrome. We are seeing patients coming to up with large amount of high cholesterol, high triglyceride, a very large patient numbers with obesity, hypertension uncontrolled diabetes, and that is the reason why we are seeing so many numbers coming to us with hyperuricemia. Now, do all hyperuricemia patients come up to us with gout or the joint problem? No, hyperuricemia is just a sign of a metabolic disease. When you get hyperuricemia, in fact, it's an eye-opener to the metabolic problem which is happening inside the body. So remember, when you see high uric acid, investigate these patients for lipid levels, for sugar levels, their HbA1c, check their blood pressures. In fact, a 24-hour BP monitoring would be required, and remember to advise them on their diet. So only patients who really have joint problems are to be labeled with gout. It's not necessary that all hyperuricemia patients will have gout. Now, what do gouty patients present to you with? They present with tophaceous gout, that is gout crystals which are deposited just outside the bone but near the synovium. These patients come to up with severe excruciating pain in the late night or early morning. They get up because of the pain, because all the uric acid has started causing plenty of inflammation in and outside the joint. Many of the time they present with a great toe or a knee infusion or with a thumb joint pain. Sometimes your elbows may be inflamed or even your earlobes could be inflamed. 20% of the time the shoulders could be inflamed because of a gouty arthritis, but shoulders are much rarer compared to the great toe or the ankle involvement. So what do? You go back to your doctors and ask them for the detailed drug. So most of the time they would do a creatine clearance, they might give you colchicine, and then they will ask you to follow up with certain group of investigations. But remember, xanthine oxidase inhibitors should be taken for a long duration of time as prescribed by a doctor. But also remember that many of these gout patients could be a sign of metabolic disease like dyslipidemia or cardiovascular risk. So remember to investigate yourself for high sugars, high lipids, uncontrolled blood pressure when you see a high uric acid. What is the importance of diet when you have gout? It's very important that you stop eating red meat or shellfish or a diet in high purine levels. So remember to take a dietitian reference, drink plenty of water and do your exercise regularly, decrease the fat amount of content. Especially when you are doing a ketogenic diet, remember you could develop acute gout. So remember to check your uric acid when you are doing a high ketogenic diet for weight loss as well. Thank you.